If you've been seeing a lot of beards this month, it's not your imagination. While they keep men warm and protected, it's a statement in support of Manuary to raise awareness of head and neck cancers among men who have a higher rate of diagnoses. Well, let's welcome Dr. Chera, professor of radiation oncology and otolaryngology at MUSC. Did I get that right?
Yes.
Okay, good. But on a serious note, head and neck cancer of men is on the rise. What is the prevalence of this type of cancer in men these days?
Yeah, so there's about 50 to 60,000 cases of head and neck cancer that occur in the United States every year. Head and neck cancer occurs twice as commonly in men than in women.
Okay, so twice as common. Are we seeing cases exponentially rise, or is it keeping in line with the population growth?
Yeah, so one of the major drivers of head and neck cancer is infection with the human papillomavirus. And there's been a somewhat of an exponential rise over the past 2 decades in cancers in the throat caused by HPV.
Okay, and is HPV only passed on through sexual contact?
Primarily, that's the main way it's passed on. The majority of us are infected with this at some time in our lives, but the majority of us will clear the infection.
Okay, and before it was HPV, it was other factors. Are those still factors today? And maybe you could name them off. Yeah,
tobacco and alcohol are the traditional risk factors for head and neck cancer, and those are still causative agents for head and neck cancer, but the use of tobacco use has gone down over the years, and so now really the major cause is HPV, but alcohol and tobacco can still cause head and neck cancer.
They do. And when does these cancers start to manifest themselves? What demographic are we looking at?
Yeah, typically it occurs in a man and when they're the age of 50 or higher is when we see these kind of cancers.
Okay, and can you name off some of those cancers? When we say head and neck, what exactly are we talking about?
Yeah, I mean, skin cancers occur on the head and neck quite frequently, but also there can be cancers that occur in the throat, and these are typically called squamous cell cancers, and these would occur in the lining of the mouth or the back of the throat, but also in the sinuses and the inside of the nose. You can also get cancers in other places like the salivary glands.
Oh, wow. And there have been some famous names associated with these types of cancers. Michael Douglas, we were just talking about, and others who are bringing more awareness to something that obviously is growing. But when we're talking about testing for it, there is a new blood test to know whether you have the cancer or not.
Yes, there's now a commercially available blood test for HPV cancers that's available. It's used predominantly in patients who we think have cancer, and we use it to detect the HPV virus in the blood, but then also to use it to monitor how the cancer responds to treatment, and then after treatment the blood test is very useful at surveilling for any type of cancer recurrence.
And there's a very interesting distinction there, because that's a blood test to determine whether the cancer exists. What about whether the virus exists among men? Because a woman can go to the gynecologist and be tested for HPV and be told whether they have it or not. Can a man be tested just the same?
Yeah, there's not as good screening tests of the throat to see if there's an HPV infection. There are some oral rinse tests where you gargle and they collect a salivary sample and they can check for HPV, but it doesn't work as well as the tests we have for women.
I see, okay. What about preventative measures? I mean, it's out there, it's very prevalent, so how do you protect yourself from HPV when it's sort of invisible in a way?
Yeah. So there are HPV vaccines that are used and they're approved for young adolescent men, but it's also approved for young adults up to the age of 40. And so if that is something that you can do to reduce the risk of getting an HPV infection is get vaccinated.
Yeah, and there are viewers who are concerned about getting yet another vaccine. I think particularly since COVID, with all the boosters and new vaccines, you name it. So is that for everybody? I mean, is it necessary? Is it encouraged for all people to go out and get that vaccine?
Yeah, national societies and guidelines recommend that both young girls and boys do get HPV vaccines to prevent the future contraction of an infection and development of a cancer. So it is recommended.
Okay, but what is the difference between, because most HPV diagnoses go away on their own, so the ones that are the more serious, what is the prevalence of one over the other?
Yeah, I mean, there's over 100 subtypes of HPV, and these vaccines are designed to prevent the infection of the most common types that cause benign tumors, but also cancer. And so, it's a probability in a game of risk. Not everyone who gets the infection will get cancer, but you don't want to be the person who gets the cancer. So vaccinations are a good thing.
Okay, all right. So vaccinations also just lifestyle and just making sure you go for your checkup. And as a man, and talking to the men out there who are watching, what about those who say, I don't need to go to the doctor?
Right. I think it's very important that we have a family doctor, a primary care physician that we see at least once a year, especially as you get older and you get into your 30s and 40s to get the yearly checkup. Yeah. But there's also a lot of other health maintenance things and other cancers that you need to be screened for, such as colon cancer, prostate cancer, lung cancer. And so there's a lot of things that need to be taken care of as we go older.
Indeed. And it's also important to say here that MUSC has many research clinical trials studying newer treatments to improve cure rates and decrease side effects as well. So you're always doing something innovative at MUSC. I want to thank you so much for joining us, Doctor.
Thank you for your time. Thanks for having me.
We're back after this.